Welcome back to This is VANCOLOUR. Earlier this month, Provincial Health Officer Dr. Bonnie Henry announced that BC would be ending its universal mask mandate in healthcare settings. So that's not only hospitals and clinics, but also long-term and assisted living facilities. The announcement made BC only the second province in Canada after Saskatchewan to drop this public health restriction. Some folks, including BC's Human Rights Commissioner, raised concerns that this decision was not properly prioritizing the health and safety of vulnerable people. Let's talk about it with my friend, the president of Down Syndrome BC, the host of the TELUS Talks podcast, local broadcasting legend. She is, of course, Tamara Taggart, and this is Tea Time with Tamara. Hi, Tamara.
Hi.
I love this color choice.
This is a fluke. I can't even, I'm shocked. I always wear black. I'm going to wear color, and then I walk in and you're wearing the same color.
You look fantastic.
So do you.
Thanks for coming on tonight. Of course, I want to talk about the removal of perhaps the final mask mandate in BC. But before we get to that, I just find this whole conversation around masks to be silly, right? Like, it just riles people up on both sides. People who want you to wear a mask everywhere, and some people who don't ever want to see a mask, and they'll criticize you for wearing a mask. Well, how do we get here? How did masks become this weird cultural war battleground?
Yeah, I've thought about it a lot, and I think it's because, and I'm serious, I think that white people don't like to be told what to do.
Oh, wow.
I really do. Like, we don't like to be told what to do. Like, wear a mask here, don't wear a mask there, whatever. We just think we can do whatever we want whenever we want. I mean, I don't know what the answer is. What else could it be? What else could it be?
Wow. So you think it has something to do with privilege, essentially?
100%.
Yeah.
This is like, I've heard people call it, it's white supremacy. This is for sure. I think taking it out of hospitals and long-term care facilities and that, I think that's eugenics, in all honesty. I think that it's a mask. Like, who cares? We should be wearing masks at the hospital all the time.
Yeah.
Like, if we've learned something in the last 3 years, we've learned about viruses. We've learned about how nice it is to not have a cold for 3 years, how nice it is to not get the flu, right?
Yeah.
So why can't we learn that it makes sense. Don't go where there are sick people without wearing a mask.
Is part of the problem that if you Google, are masks effective, you get some people saying they're super effective. You get some people they're saying it's not. I'm just saying, if you're just a regular person and you're trying to figure out the science, it's hard. It's hard if you're just by yourself.
If you're
right?
a regular person, you shouldn't be trying to figure out the science. I'm not a scientist.
I'm definitely not a scientist.
But I have common sense.
Yeah.
And I know that if I'm sick, I should stay home.
Yeah.
I also know that if I'm going to the hospital and I'm going to see somebody who is sick, it probably is a good idea, now that I know, to wear a mask.
Yeah.
So that I keep everybody safe. It comes down to, yes, it comes down to privilege, but it also comes down to, where did we forget about community care? Where did we forget about looking out for others who are more vulnerable to illnesses? Where did we forget how to be just nice to each other?
Yeah.
If you don't want to wear a mask, don't wear a mask. If you want to wear a mask, wear a mask. But I do think that we should all be wearing masks when we go to a hospital or go to see someone elderly at a long-term care facility.
So I'm going to imagine that once Dr. Henry made this announcement, you were even more livid than you are right now.
Well, I'm not even livid.
Because you're fired up.
And it's fair. Just so, I just think it's so shocking to me. When I heard the announcement, to me, the first thing I thought of was, this is eugenics, like 100%. So now we don't care about
So eugenics
people.
in the sense that we're not caring about the lives, essentially, of people who are sick or vulnerable.
Absolutely not. All those people are expensive. I mean, it's a harsh thing to say, but it is true. You talk to anybody who feels the same way as I do, and they will tell you the same thing. My kid with a disability, he's expensive in the grand scheme of things.
And that's a terrible way to look at it.
A disabled person in the hospital, they're expensive. So why else would we remove masks? Why else would we remove masks? Elderly people at long-term care facilities, they're expensive.
I guess, I'm just thinking about this, not that I've been in any hospitals or any assisted living places recently, but was there a big outcry from people who didn't want to wear masks in these healthcare facilities? Like, where was this push that we had to get rid of this mandate when clearly it makes sense, right?
I have no idea. I think that, maybe sure, there's complainers everywhere. We all complain about things, right?
Yeah.
So I'm sure that if you're working and you have to wear a mask every day, all day, and you think it's stupid, well, yeah, I guess you would complain about it. I have no idea where the decisions come from. I don't know. All I know is that if we can't protect our sickest, most vulnerable people in our communities, we are really pathetic. We are really the lowest of the low if we cannot protect those of us who are vulnerable. What are we going to go back to? It's okay if you come to work sick now? It's happening now.
We have. Yeah, you don't have to 100%. Wait 5 days.
No, you don't have to.
You don't have to test.
Nothing. I don't know anybody who's still testing. I did 2 tests last week because I was going to see people and I wanted to make sure that I wasn't, I didn't have COVID or,
Yeah.
I don't. People say, oh, you're paranoid to me, or, oh, it's over the top, or, oh, you just want no, it's none of those things, actually. I know what it's like to have cancer. And I cannot imagine. I worked at a place where people came to work sick all the time. And I caught every single cold, every sneeze, every sniffle, everything. I caught it all because my immunity was down. My immune system was shot. There are tens of thousands of people like that walking around right now. So we've learned something. Just wear a mask. Like, what is the big deal?
Is part of the problem that we're so ingrained in our own silos or echo chambers that we don't even want to talk to each other on this? So if you've made up your mind on masks and you hate them and you don't think there should be mandates, you just don't even want to entertain the idea that perhaps we should be wearing masks in a hospital.
Well, first of all, mandate is like this word that everybody likes to throw around now, right? Mandate this and mandate that. Nobody's mandating you anything. Nobody is mandating you. If you don't want to wear a mask at a hospital, don't go to the hospital. I don't know anybody that wants to go to the hospital and be sick, right? Yeah. But if you're going to visit somebody and you don't want to wear a mask, then don't go visit them. Why would you?
Yeah.
I don't get that. But so we've overused all these words and now they're trigger words for people.
Right.
Certain people. But I don't think that,
I guess what I'm getting at is it sounds like you're preaching to the choir ultimately, right? Like, I'm on board, I get it, but people who don't get it,
who don't get it, they seem to be quite loud about it. And it's like, you look at the people who are loudest about it. You look at them all. You look at the people who are most angry about masks. You look at them and you line them all up or put them in a big group and you tell me, what do they all have in common?
I'm going to let you say it.
I don't know. I'm asking. I'm just saying. And I can say it.
You can
because,
say it.
And we all know it's true.
Yeah.
It's ridiculous. It's privilege. It is white supremacy. It is eugenics. It's all of the above. It's ridiculous.
That is a mic drop if I've ever heard one. I don't think I can top that. Tamara, I hope to do it again on something perhaps more fun and less troubling. But
please, I'm going to get so much hate mail now. The trolls are going to be coming at me.
Well, hey, I got your back. Thank you so much for being here tonight and for really letting loose, sharing your true opinions. I appreciate that.
All right.
It was a good session of tea.
Nice seeing you.
Absolutely. Folks, she's the host of the Tell Us Talks podcast. Find it wherever you listen to your podcast for some incredible, in-depth conversations with true experts. She is my friend. She is, of course, Tamara Taggart. Now, after some business, I have a few things to say about how we view homelessness in this city, province, and country as a whole. That's up next.